Welcome. It's Tuesday, January 25th, 2022. I've been busy with work for a while, but today I want to turn my attention from my other work and address in this video a really important topic. And that is some particularly dangerous misinformation being spread about COVID deaths in the United Kingdom. I'm going to focus on the misinformation in John Campbell's recent video, Freedom of Information Revelation. He posted this on January 20th, just a few days ago. And I'm focusing on this because of Dr. Campbell's reach and his influence. His reach on both the general audience and his influence on other powerful voices in the media around COVID. This is a really important topic, and I hope you stick around. Hi, I'm Prof. Greg. I've spent my career in biomedical research, first after my PhD and postdoctoral training in the biotechnology industry, and more recently as an academic. I'm currently a professor at the National University of Singapore. I want to make a couple of disclaimers before we move forward. First, this video is made on my personal time, and it's paid for by me out of pocket. I'm not funded by any industry, and this channel is not funded by my employer or anyone else, although you're welcome to buy me a coffee if you want to support it. I have no conflicts of interest regarding this content. Also, as usual, I will provide links in the description to everything I reference and in the analysis that follows. Okay, let's get started. One of the most persistent lies of the COVID-19 pandemic has been that COVID is not all that dangerous, and in particular, that COVID deaths have been vastly overreported. Now, there have been versions of this lie that have appeared as early as mid-2020, and they've been reinforced and they've been recirculated by powerful figures with political or social agendas, usually opposed to non-pharmaceutical interventions or NPIs, such as lockdowns, social distancing, mask requirements, and so on. This video is not about those social and political topics. I'm going to focus on the lies about COVID deaths. Now, the same false argument about COVID deaths that was kicking around in 2020 is still around, but now it's been taken up by anti-vaccine advocates and, sadly, by Dr. John Campbell. Now, in previous videos regarding Dr. Campbell, I've reached out to him by email for discussion. I've never heard back from him, but in this video, I have no intention of reaching out to him before posting it. I have no intention of reaching out to him by email. And the reason is because on this topic, his video is so dangerously misinformative that I can't see how he could have made it in good faith. His video spreading this falsehood, this idea that COVID deaths are surprisingly low, has been seen by millions of people, and it's important that it have a response. And the urgency of that response can't wait for a private email exchange that will probably never happen. Now, Dr. Campbell is welcome to contact me if he wants to follow up directly. Here's how the rest of this video will play out. I'll let Dr. Campbell explain his position and his interpretation of the COVID death data and the recent Freedom of Information report that he focuses on. And then I'll show specifically why his interpretation is so wrong. Now, this isn't an innocent mistake. Spreading a falsehood that understates the mortality of COVID by an order of magnitude is not a benign false belief. It's a false belief on which people may make really important life decisions, so it matters. Here's Dr. Campbell introducing his own video.
It's Thursday, the 20th of January. Now, there's been an awful lot of debate about deaths in this pandemic. And there's a new Freedom of Information request release from the United Kingdom that shows the number of deaths actually solely attributable to COVID may be way lower than anyone had thought.
And here he is making the central points of his video at the beginning.
So we have one figure for the total deaths there, 127,000. We have another figure for the total deaths there within 28 days of a positive test, 152,872. And then where COVID-19 is mentioned on the death certificate as a contributory factor to death, 174,000. So we've already got three different figures, but now we've got a fourth, and this fourth figure is just a little over 17,000 deaths. And I'm doing this as a single video because I'm still processing this information. It's really quite profound. Now, this is from a Freedom of Information request. Deaths from COVID-19 with no other underlying cause. In other words, people that were otherwise healthy, that don't have heart disease, that don't have lung disease, that don't have diabetes, and yet died of COVID-19.
And finally, here he is talking about what he sees as a lack of media attention to this important story.
Freedom of Information request, and the Freedom of Information request was answered by the Office for National Statistics, and you can read the actual report there. Now, this actually came out last month, and I've just discovered it yesterday. That's why I wanted to bring it to you now. There's been no mention of this whatsoever on mainstream media, at least on the BBC, sort of ITV, Channel 4 in the UK, and I haven't seen anything on the US channels that I follow. So surprising that they haven't picked this up, because it's a huge story for media to cover, and they haven't.
The first thing to note is that what's presented in the Freedom of Information report that Dr. Campbell focuses on is not a revelation, and it's not even new. COVID mortality data, including pre-existing conditions, has been published openly by the Office of National Statistics in the UK every quarter, and that's mentioned very specifically in the Freedom of Information report Dr. Campbell cites. It's also not striking or profound or even newsworthy that many people who died of COVID had some pre-existing condition. That's not newsworthy unless you're committed to misusing the data or misleading the public or understating the mortality of this disease. We'll see why this is the case shortly. Now, Dr. Campbell makes the following claims. I'm paraphrasing here, but and quoting sometimes. So the first, he says that the number of deaths solely attributable to COVID may be way lower than anyone had thought. So he's referring to the number of deaths solely attributable to COVID in that Freedom of Information report. That part is factual, but then way lower than anyone had thought is the misleading part of that. And it really is misleading, as we'll see. Secondly, he says that this discovery is profound, that's his word, that it's new, and that it arose and was perhaps made possible, but certainly came from a Freedom of Information request. This is why he sees it as newsworthy. And finally, he says that mainstream media has not picked up this huge story and given it the coverage it deserves. So those are the main claims, and I won't use any more excerpts from Dr. Campbell's video, but just do a proper analysis of this. So Dr. Campbell compares the following statistics. The first is estimated excess deaths. And so this is an estimate, and he uses between the 13th of March 2020 and the 7th of January 2022 in England and Wales. And the number that he uses is 127,704. The second is a statistic reported by the government, which is deaths within 28 days of a positive test. Now, that's a different date. That's much more updated, and we'll see why. And so that's 152,872, and that is, I think, all of the UK. He's not clear on this, but I think it's all of the UK. The third is deaths where COVID-19 was indicated on the death certificate as contributing to the death. And that is even larger, 174,233. And then he adds this fourth, which is the information from the Freedom of Information report, and that is deaths from COVID with no other underlying causes, and that number is 17,371, although that is just England and Wales and only through the third quarter of 2021. Now, as you'll see, Dr. Campbell makes this note that there are some differences with these data, and part because they cover different time periods, and part because they cover different countries. Some of them are all of the United Kingdom, and others are restricted to England and Wales. However, all of this data is public. So while Dr. Campbell didn't make it consistent and comparable, I will. And in this analysis, I'm going to use the same criteria as the Freedom of Information report. That is, I'll focus just on England and Wales and up through the end of the third quarter of 2021. And so again, below, there will be links to both the data and to my analysis. I'll also use all the same statistics Dr. Campbell uses, but I'm going to leave out this first one, the excess deaths, because that's not a statistic directly, that's an estimate, and I'm leaving it out for a couple of reasons. One is because it's estimated weekly, not daily, but also because there are several different ways to make such estimates, and they all depend on models of prior years. So if you compare deaths 1 year to the average of previous years each week, for 2020, that might be fine, but what about 2021? You have to exclude 2020 if you want to look at the deaths from COVID and so on. So instead of getting into the weeds of those topics, I want to focus on observed data that is meaningfully comparable. So the first statistic is deaths within 28 days of a positive COVID test. And so this is data that's reported by the government, and it's used as an estimate of COVID deaths. And it can be used as an estimate of COVID deaths because most people don't die within a given 28-day period. Now, there are some advantages with this measure as an estimate. Certainly for the government, there are some advantages. One is that it's relatively easy to report. You just need deaths and you need COVID test results. They're both captured directly in databases, and they just have to be matched with individuals. What you don't need is you don't need to actually read the death certificate because that's not what is being included. So it's relatively up to date. Notice that Dr. Campbell's version had this up to January 19th, and he made his video on the 20th. However, it's obviously flawed in the sense that deaths can be overcounted or undercounted. They can be overcounted, for example, if somebody gets a positive test and then they're hit by a bus and die. And so that would be counted as a death within 28 days of a positive test, but it's obviously not from COVID. But they can also be undercounted because somebody can die from COVID 29 days after getting a positive COVID test, and they wouldn't be counted within this statistic. Nonetheless, the data is available from the ONS for every day, and it can be converted to quarters to match with the Freedom of Information request. So using ONS data, I downloaded, did the conversion, and this is the graph. And there were 125,833 deaths within 28 days of a positive COVID test through the end of September 2021, restricted to England and Wales. This is, of course, somewhat lower than Dr. Campbell's number of 152,872, but my analysis only includes England and Wales, and it ends at the end of the third quarter, so it makes everything comparable, apples to apples. The second statistic Dr. Campbell uses is a better estimate than from the OMS, and that's deaths with COVID-19 indicated on the death certificate. This is slower for the ONS to tabulate because it requires actually reading all of the death certificates and coding them into a database. This statistic is also at the heart of the disinformation about COVID deaths. So here I have an example of what a death certificate in the UK looks like. I got this from geekymedics.com. You can also download partially filled copies from various localities. I know I found one for Coventry, but they look like this, and this is the standard. I want to make a couple of notes. Here under cause of death, there are up to 3 causes, and they're sequential. So the direct cause of death, other disease or condition leading to that, and another disease or condition leading to that. So that's a causal chain that is recorded. And then in part 2 here, there's other significant conditions contributing to the death, but not related to the disease or condition causing it. So let's note what that means. So it can have up to 3 causes in this causal chain, and there's this other area indicating other conditions contributing to the death, but not related to it. So COVID can be listed in that chain, in those 3 links of that chain, up to the death, or it can be listed as a condition contributing to the death, but not related to the actual causal chain of those 3 links. So this second statistic that ONS publishes is whether COVID is mentioned at all. So it is either mentioned up here, as in the 3 chains in the causal chains, or as a condition contributing to the cause. Now, I downloaded that data and tabulated for the 7 quarters ending in September 2021 for England and Wales. And it adds up to 148,991 deaths with COVID indicated somewhere on the death certificate. Now, why do people who insist that COVID deaths are overstated get so agitated about this particular data? Here's a comment from one of my viewers on one of my other videos. And it's responding to a comment I accidentally made from my other channel. So that's why it's addressed to Higher EduTech, my other channel. This comment came in on the day that John Campbell published his video on this report. And I got a flood of comments similar to it. And it basically makes the point that is the underlying point within Dr. Campbell's video. And that is, how many people do you think have died from COVID, not with? Are we elevating? Are the statistics that are reporting people who died with COVID, but not from COVID? This is the basic idea. And this is a very angry question. Does it mean that they died from COVID, not with COVID? Well, let's look at it. So if you read the Freedom of Information report that is the focus of Dr. Campbell's video, it provides a link directly to the relevant definitions. Again, all of this was published, all of it was available, and none of it is surprising or even newsworthy if you don't have an agenda to mislead people. And in addition, if we go back to that COVID death certificate, the death certificate and where it can be mentioned, if it's mentioned on the death certificate, even if it's not mentioned as the 3 links in the chain that can be listed on a death certificate in the UK that lead directly to death, it is also only mentioned if it's contributing to the death. So somebody who has COVID but is, say, hit by a bus and killed in a violent accident wouldn't actually have COVID listed as the cause of death on their death certificate, either in part 1 as directly leading to death, or even as contributing to the death if it was completely unrelated. But what about the data in that report? The data that Dr. Campbell said was such a profound revelation. The report describes its numbers as, and this is a part of it, as death registrations for 2020 and 2021, so the 2021 later ones are provisional, that were due to COVID-19 and were recorded without any pre-existing conditions, England and Wales. So that is effectively, that is these up here. So it's due to, in the first, so it's in part 1 here, not part 2 here, and it doesn't have any pre-existing conditions listed down here. So it has to appear up here in the first part, and there's nothing down here that counts as a pre-existing condition. So that's the distinction here. And you might ask, well, why does the ONS include both part 1 and part 2 in their in that statistic that we just looked at, in this statistic on the death certificate? And the reason is because if it's totally unrelated, it wouldn't be listed there. And if it is contributing to the death, it should be listed there. Now, I think that people who argue that somehow the over-reporting is that only the ones in Part 1 should be listed, and if we only listed the ones in Part 1 and got rid of the pre-existing conditions, we'd get this much lower number, 17,371, and then we wouldn't be as agitated about COVID mortality. That seems to be the basic argument. But again, the data is published, so we can go ahead and look. So even though, so in this case, COVID is listed in the first part of the death certificate, and there's nothing listed in Part 2 as those contributing factors. And that's the number that is 17,371. But again, you can get the original data. So I downloaded the original data from the ONS, and I was able to reproduce these numbers exactly. And so I also have the numbers for individuals who died from COVID. So that's to say, COVID is listed in Part 1 of that death certificate over the same time period in England and Wales, regardless of pre-existing conditions. And this number is 131,372. In other words, according to the ONS, 131,372 individuals in England and Wales died due to COVID, that is from COVID, as of September 30th, 2021. That's not with COVID and died of something else. That's due to COVID. Of course, that's a little bit smaller than the number with COVID listed on their death certificates, but it's not that much smaller. And it is much, much larger than the 17,371 number Dr. Campbell and others have been bandying about. In this, I plotted this as a stacked bar chart so you can see the number with no pre-existing conditions listed, and that adds up to 17,371, and the other 114,000 are in these pinkish numbers. And why are Dr. Campbell and others focused on these green numbers and as if somehow they're the relevant number, and the ones in pink with some pre-existing conditions are somehow should be not thought of differently? And the argument seems to be that those who died from COVID and had pre-existing conditions were already in some sense ill, and that their illness or their condition means that we shouldn't add as much importance to their deaths as to these 17,371 individuals in green here who were cut down in the prime of health. Now, Dr. Campbell makes an error-filled argument about ages of death and life expectancy in the UK that runs along these lines, and it's frankly offensive. I don't want to spend time on the lack of humanity in that shallow argument. But if you're curious about the errors Dr. Campbell makes in discussions of those issues, I encourage you to watch Dr. Susan Oliver's excellent video, which will be linked up in the corner, which goes into some of his mistakes. But offensiveness aside, is there anything to it? Were the 114,001 individuals who died from COVID in England and Wales before October 21 and did have some pre-existing condition, were they all knocking at death's door, and did COVID just kind of ease them across the threshold? I still think that's an offensive question, but we can get some insight into it by looking at data from the Intensive Care National Audit and Research Center. And this center publishes an updated COVID-19 report about intensive care units in the UK. So most people who die from COVID go through the intensive care, and so we can get a sense of how sick they were from the reports from the intensive care unit. And so let's do that. So if we look at the intensive care reports, this is the Intensive Care National Audit and Research Center COVID-19 report downloaded just yesterday. The overwhelming majority, almost 90% of patients admitted to intensive care in the UK were living unassisted, ordinary lives. They were living independent lives with no assistance prior to their admission. There was a small proportion who did require some assistance, so almost everybody else, and then a very tiny proportion, less than 1%, who required total assistance. So 90% required no assistance. They were living ordinary, unassisted lives, overwhelmingly living unassisted lives. And they were killed by COVID, or in this case, they were admitted to intensive care with COVID, from COVID, and so those would be the majority of those of the deaths would have gone through this intensive care, and most of them, the vast majority of them, were living independent, unassisted lives. If you also look down here, some of them, many of them, of course, had pre-existing conditions, as many of us do. But we can see that a very small percentage had very severe comorbidities. These were ordinary people living ordinary lives, mostly unassisted lives, and their lives were taken, or in this case, they were taken by COVID into intensive care. Okay, but maybe this is biased. What about the most severely ill patients, the ones who were intubated and required ventilation in intensive care? Those are the ones we hear about in the news. But maybe they were the ones knocking at death's door until COVID gave them a nudge. The audit also has these, and no, they were also overwhelmingly independent people living unassisted lives, largely without severe comorbidities. This table shows the people who were not just admitted into intensive care, but were invasively ventilated within the first 24 hours. So they were brought into intensive care, and then they were invasively ventilated within the first 24 hours. And again, overwhelmingly living without assistance, independent lives in their daily lives. A small proportion had some assistance, and a very small proportion required total assistance. And the vast majority had no severe comorbidities. So what are the takeaways from this? What can we learn? Well, the first is that at least 131,372 people in England and Wales died from COVID-19 by September 30th, 2021. It's that number that we should think of as the minimal mortality in England and Wales from COVID-19 up through the third quarter of 2021. Of those, 17,371 had no registered pre-existing conditions. Somehow, Dr. Campbell and others who focus on this number seem to think that the 114,001 individuals who died of COVID and had some pre-existing conditions, that somehow that they count differently than these ones. I find that offensive, and as we've seen, those individuals who did in that 114,001, the overwhelming majority of these people were living independent, unassisted lives before COVID-19 killed them. Now, I honestly wish that I wasn't making this video. I don't get any pleasure out of making this particular kind of video because it's addressing a kind of callous argument that dramatically understates the mortality cost of a disease that has killed millions of people around the world for reasons that, as far as I can tell, are only motivated by politics or social beliefs about the kinds of measures that might be taken. None of that matters to the underlying truth. And the truth is that in England and Wales, 132,000 people were killed at least by September 30th, 2021 by COVID, not with COVID, but from COVID causing their death. If you got some value out of this, feel free to comment, like, or subscribe. Do whatever it is. Share it with people if you think it's useful. Also, feel free to check out some other things. I'm going to have a link to Dr. Susan Oliver's video addressing some of those topics, as well as a link to my own playlist on misinformation. And I will see you in the next video.